Hello, this is Alan Scott, Chief Architect for Red Hat's Healthcare Market Team. Today I'd like to talk with you about the CMS Final Rule mandates and how they're driving transformation with information. As we think about the CMS Final Rule regulations, it's key that you think about this being a shift of focus around consumerization, specifically in the area of reducing data barriers with healthcare information. When you think about key details around the regulation, we like to put those into three areas. The first one is the trends. The key trends to notice are modernization, both of information access as well as information and integration access. The second key trend is around consumerization for expansibility. And the last key one is the trend line of sharing data beyond healthcare's traditional four walls. When you think about the key integration standards that are going to help the trends, the final rule mandated some very specific things. First, it focused on FHIR as a newer integration standard, that is Fast Health Interoperability Resources, specifically the R4 version. Then it focused on Smart on FHIR. Smart on FHIR is how you securely integrate those applications together from a security perspective. The next two things are focused around OAuth 2 and OpenID Connect, two very well-known, very highly used authentication and authorization standards. And as you think about those key things and all the new things coming into the healthcare and data integration space for data access, let's look at the rules and regulations, specifically what the mandate is asking for in this revision. The specific focus is around patient record API capabilities, provider directory API capabilities, payer data API capabilities, and other very specific things with how they integrate to data. However, the last one we're going to cover here is about notification of discharge and other events. With knowing that, some of the key things we wanted to talk about are the key timelines and requirements for these API and other accesses. Patient data access is supposed to start in early 2021, but as you can imagine, with COVID and everything else going on in the industry from this COVID pandemic going on, they have decided to move fines and fees back to July 2021. Specifically, patient data access API is about giving people access to their claims, their clinical data, and if they're a Medicare Part A and D customer, their formulary data. A big change on the provider side is provider directory API capabilities. The intent here is for them to be able to share provider names, addresses, information, and specialties with others that are needing services or needing service capabilities. The last big enhancement mentioned in CMS Final Rule is payer-to-payer data APIs coming in 2022. This is very specific around using a standard called US CDI version 1, and the mandate focuses on 5 years of access after patient switch plans, which means that as your insurance might switch or as you might buy new insurance, you or any system that you need or those payers can connect to each other to get your information for up to 5 years. As we talked about with US CDI 1, there's a few things to note that this new standard about data is all intended to do as it's built upon FHIR. It's meant to give you access to common information. We've listed a few here, such as allergies, immunizations, problems, vitals, medication, clinical notes. While that's a lot of information, if you get this presentation from us, we've included some helpful links here. And our intent is to give you access to the CMS Final Rule pages, some core resources around what FHIR is, what approved means, some common implementation guides, and some data guides. Now, as we think about all this information, it's key to start thinking about the transformation that's going on. This to us is key because it's where technology is meeting business, and the only way to think about it is data is now the asset, because data needs to be moved for patients to receive care and transition between systems. So as you think about that concept, one of the key things we focused on was how do we help the healthcare industry using our phenomenal open source capabilities and our open culture and mindset to deliver something. So what we wanted to come and focus on was bringing all those assets to bear that our existing customers have and that our capabilities would support. For this, we came up with Connected Health and IDaaS. This is focused around helping modernize and transform areas of integration, moving from a COTS product mindset to an agile-based, comprehensive application development and delivery mindset and platform. It's also meant to help focus around technology coexistence. This way, organizations can enable innovation and they can keep reducing risk while providing tremendous value to their customers, as well as help data become a service that can be commoditized. And if you think about, well, those business drivers, the key IT requirements that it's going to enable are helping time to market, helping start to build expert systems and focus on them, helping build event-driven healthcare, the ability to sense and respond to real-time information and do more appropriate things, and also scalability and extensibility. If we think about those things and you look to the visual to the right, the way we express what IDaaS is around thinking of it in different zones. The first thing to know is the data zone. That's where data lives. That's how you connect to it. That's where the focus area of it should be. Then you think about the application zone, which is how do you want to take that data? How do you want to shape it, reshape it, dynamically transform it, business enable it, or do complex event processing with it? And the last one is how do you want to present that data? That could be something as simple as a common interface, whether it's a user interface or an integration interface. It could be reports or analytics. It could be through APIs, or maybe it's even a traditional SDK. As you think about connected health and what that really means, the way we like to say it is there's 4 main component types that we have for it. We call those the 4 R's. The first one is about receiving data. With this, the IDaaS brand itself has a sub-brand we call IDaaS Connect. And the reason we've done this is so people will understand it's all about connecting to information, it's all about processing information, and it's all about making that information extensible for other systems. Within this, we have 3 brand examples that we typically have customers and partners that enable. IDaaS Connect HL7, which is all about HL7 connectivity. IDaaS Connect Fire, which is all around connecting to the fire resources and modern standards that are coming out, specifically with the CMS Final Rule. And we also have IDaaS Connect Third Party, which is about connecting to data in those third-party sources where it exists. Could be SFTP, could be files, could be queuing systems. It could be any of these things. There's over 100 plus connectors that we have extensibility to connect to. And once you receive data, the goal is then how would you route that information? That information is incredibly important, and since data is the asset, routing information needs to be consistent and enterprise enabled. Through that, we have our IDaaS route component and the brand, and that specifically is IDaaS data distribution. The goal there is that data can be distributed as needed to by any organization or in whatever it needs to, by application, by facility, by organization, by data type. However data needs to be sliced, that's what the routing piece is for. The next component is the run component. That is where you can enable real-time applications to be implemented against data as it's streaming. For that, our IDaaS brand is called IDaaS Dream, which is about data real-time enablement or data real-time management. Some examples of this are IDaaS data tagging. That's where we can look at data as it's coming through and tag it for relevance for things like x-rays. There's IDaaS AI Doc, which is a signed insight for disease outbreak and condition detection. That's where we're working on a module that you can classify a myriad of data as it's streaming to figure out, is it something new? Is it something, a condition that's happened? Is it something that's going to benefit a consumer implementation that you have going on? How can you look at that data and assign it some level of meaningful usage. The last is IDaaS Event Builder. That is our ability to take data and reshape it as needed, build events real time, also do transformative data access. There's over 120 different POJOs that come enabled for our customers to get it. There's also a series of others that are under development or being developed as assets. The last R that we wanted to talk about is our resolve components. That is where we have our auditing and error handling, which is IDaaS Data Hub. That very specifically is all about how you can have insight into what's going on in the system, how you could see what it's done, and how you could always go back and factually discuss with anyone any transaction that has occurred. So as you think about what IDaaS is, all the capabilities that it could bring to the table, some very common use cases that we'll specifically go through as you look through our demonstrations and as you talk with us about them. The most common one that we're seeing is those fire resource processing capabilities that are needed for CMS. Notice that the fire server here is optional. Notice that it's optional in the window. That's because we've tested this with several fire servers from several different vendors. Our intent here, since data is the asset, is to enable processing and to enable access to information, whether it starts as fire or you need it to be reshaped to be fire. The next key thing that we've done is our standard legacy clinical integration, or HL7, right? That is where we could take data from HL7, build it into streams, do analysis on it, or convert it effectively to another transaction type, maybe fire, for implementation usage. Another very common thing is that data transformation and or routing service that we have talked about a lot. That is where I want to take something like maybe a CSV file because I have physicians' information that exists in a database that's a JDBC compliant database. So I could use IDaaS Connect third party to connect to that and then stream and route that into something to go build fire messages for it. And the last common use case, which we pretty much talked about in this example, was how do I connect to data where it is through a set of adapters based on connectivity type to enable me to reshape that into the IDaaS platform. And that is a very specific subset of our common use cases that we see. So as you think about those use cases, let's walk through some potential demos that you could download from our GitHub site that we'll talk about later, or you can leverage immediately with our source code. HL7 based message integration. This is if you implement IDaaS Connect HL7, we don't have an HL7 v2 message standard that we don't support, and we don't have any vendor implementation guidance that we've implemented only for. So far, we've tested it with dozens of vendors, all 2.1 to 2.8 message structures, and we've been successful with those. You also have the notion of fire resources. While we support over 60 of them in the platform, the key thing to note that we have demonstrations for immediately out of the box are all of them if you choose to implement the IDaaS Connect Fire, or you can implement the concept and you can see the claim example. Keep in mind, we do support, like I said, 60 plus of them out of the box natively. You can also see healthcare event distribution immediately upon implementing the demos. And you can also see our event-driven architecture with Event Builder as we take data, process, and reshape it. We're also working on building some API examples for the CMS Final Rule. Very specifically, we're focused on how we could build blue button API examples from a traditional integration perspective and a traditional application development perspective. Also, patient data access and API, your provider directory API, and payer to payer data API access will come later. So with all that being said, the key notion is why connected health or IDaaS? For us, the key is about disruption without chaos. It's about taking our open source culture and our open culture mindset to the market space to know how we can help implement in healthcare for the positive. It's about enabling realignment to business needs quickly, but it's also about having native fire resource support, not only for CMS needs, for your own business needs as they're reshaped, and for the US CDI needs out of the box that can be extended upon what you're doing. But as you think about why else for connected health, think about that enterprise focus, about scale, reusability, and extensibility that's native in what we do. Think about how expert systems can be built and how this is a capability for enabling them. Also think about, we're not focusing on a black box or something you can't do or limiting your tools. We don't want limited tools. We want you to have the tools that you need, that you want to have. And we also wanted to provide guidance with a governance-based mindset. While I can't review all of these, I think it's very specific as you think about our important links within the IDaaS Connected Health community. I would go to github.com/redhat-healthcare, look up all of our repositories. We also have a website for our Connected Health IDaaS platform called connectedhealth-idaass.io. I'd love for you to go to both of them, look at them, give us any feedback. As always, I want to thank you for your time. Please stay safe during this pandemic. Happy coding.